5-year plan. Bio sketch. My name is Linda Ryholt. I have been working in the medical field for the last 28 years. I started out in Environmental Services Department and went on to work in Central Supply, also known as Central Processing. I then worked for a short time in a OBGYN clinic as a medical records / receptionist. And finally, I went to school and got my certification to be a nurse aide in a hospital. I worked in med-surg for a little while. They had a med-surg PD overflow, so that was pretty interesting. I learned a lot. I started my nursing career as a licensed vocational nurse, and I graduated with my LVN in 2015. I was feeling very limited as an LVN. I chose to go back to school to get my registered nurse degree, and that was in 2016. I am currently working as a with pediatric patients as a pediatric home health nurse. In the student learning outcomes that we have to achieve to graduate, I feel in the humanities and society construct, the student learning outcome was achieved / met in course Nursing 4540 practice, care of communities. The community-based service learning CBSL assignment for humanity and society construct it's a really great assignment. It allowed me to volunteer at a clinic, which I still volunteer at today, and serve a very diverse patient load. I mean, we have homeless patients, we have patients that have good jobs, they just couldn't afford to go to the doctor, or they don't have insurance, and we serve them for free. So they can get some medication there, they can talk to a doctor there, get some medical advice, which is really great. And we work with a diverse peer group. You know, we have doctors, we have med students, we have nursing students, we have nurses that are in all sorts of fields. It's just a really great place. And I really loved that assignment. I achieved 100% on this assignment. The next one is Lifespan Health Continuum Construct. I believe this learning outcome was met in Nursing 4316 Comprehensive Holistic Health Assessment. It addressed the learning outcome in the activities activities 2 for Lifespan Health Continuum Construct. Focusing on patient-centered care, for this assignment, we created a care plan that encouraged critical thinking about common and complex needs and addressed multiple health states. I achieved a 93% on this assignment. This assignment I did hand in late, so I got 5 points taken off for that. Evidence-based practice and clinical reasoning construct. I believe this student learning outcome was satisfied in Nursing 4391, Evidence-Based Practice and Inquiry. It addressed this learning outcome in the discussion number 2, Qualitative Research Study Assignment. I achieved a 95% on this assignment and I really did enjoy the back and forth that I had with my peers. It was a good conversation and I learned a lot. This assignment allowed me to explore end of life and the nurse's role using evidence-based practice, research, and critical thinking to increase better nursing judgment. The next student learning outcome is patient-client-centered care. This learning outcome is addressed in Nursing 4321, Nursing Theories and Outline, an online education class. The formal APA philosophy paper assignment encouraged me to explore my own nursing philosophy, which I thought was really great because I'd never really done that before. It forced me to ask a lot of questions to myself of what kind of nurse do I want to be. I really like that. By researching nursing theorists and evidence-based practice and collaboration with patients and their families. I achieved a 98% on this assignment. Professional roles construct. This learning outcome was met in Nursing 4550, Practice Leadership Healthcare Management System. In the Effective Leadership and Qualitative paper, I explored effective leadership qualities in healthcare using ethical, legal, and regulatory parameters, addressing professional integrity along with professional communication. I loved this paper. This paper was an opportunity for me to put down in APA format everything I feel like a leader should be, and the way that I want to be with my peers. And if I become a leader of any kind, I would prefer it's the way that I want to be. It's my goals, to achieve, that kind of leadership. I want to be a role model to my peers. So it was a great assignment. I achieved a 98% upon my completion of this assignment. Finally, we have my 5-year career plan. In 5 years, I see myself working as a neonatal nurse practitioner, specializing in neonatal care. I enjoy working with pediatric patients and their families. My strengths are putting families and patients at ease and communicating in a transparent and encouraging way. To achieve this goal, I will be taking a year off of school immediately following completion of this class and completing this degree program. I know that sounds counteractive, but it really isn't. I plan on taking off because I want to research schools, good schools that I can go to get a good education and be an excellent nurse practitioner. I'm interested in attending. I want to pay down debt in this year that I'm taking off, and I want to decrease my chances of educational burnout. So many times I see my friends going to school nonstop, and they don't take time to just take a breath and figure out, is this really the path I want to continue walking down? So I'll be asking myself those questions. According to Baylor University, the average completion time for a neonatal nurse practitioner program is 3 years. For their program, it's 3 years, and it is on my list of schools that I'd like to go to. After becoming a nurse practitioner, I hope to acquire a job at Texas Children's Hospital. I had a clinical there once, and I really enjoyed my time there. So I'm hoping to get a job there. My references for this PowerPoint were the Baylor University online nursing program. I have been there several times, and Lamar University's student learning outcomes, or the undergraduate nursing studies student handbook. Thank you for your time.